Hello again, it's John Garvey from Bayview Family Practice, and in this video I'm going to show you how we look at and comment on our blood results and correspondence that we receive on our patients. So you can see I'm in the anonymized view of my list for tomorrow's work, and there are patients that will be seen, there are scripts that need to be sent. And this is what we're looking at today. We're looking at our results. These are showing that they're blood results and also correspondence. As I've mentioned before, the little paper clips tell you that there's a message. So for example, on this patient here, if I open this, it'll say PP has an appointment for today. So that's a prevention program patient. So I'm going to open up this patient and I'm going to look at the blood results and I'm going to make a comment. So it's not enough that we simply look at the results. I must be seen to have looked at the results and to send a note to the patient, usually by means of text, to tell the patient that I've seen the results and I'm happy with them. So I'll start at the top. In this instance, I want to look at hemoglobin A1C, fine, full blood count, fine. So I'm going to come to this box here. I'm going to say in this case the blood results were normal, and I'm going to close this box. And you will notice here that it now says lab normal, and now it's added John Garvey. So that tells you which doctor has looked at this result. Come to the next blood result. And I'm going to look at the lipids, which in this case for this patient, for this age, I'm happy. LFTs and renal profile. And again, I'm going to say, I'm not going to use the phrase normal this time. I might use the phrase satisfactory. Okay. Now, my GP trainees would be driven mad because I'm forever telling them to close the loop, which means to make sure that not only are you happy with the results, but the patient knows that you're happy with the results. In Bayview Family Practice, we have a policy that in terms of anything that we perform on our patients, in terms of a blood test, a scan, an MRI scan, etc., an X-ray, we will send the patient a message to let the patient know the result has been checked. The message is not to be detailed. We'll normally send it as a text message. So here I can see I have a mobile phone number and a message saying that I can send a text message. So I'm going to come here now and I will use the lab function or the lab transaction again. And I can either put in a lab review if I've seen several bloods and I want to make a comment. I don't need to in this case. Text message is all I'm going to use. I'm going to text. I'm going to say, so I will make up a name for this patient. Susan, your recent bloods were good. And as I've shown you in the messaging video, I'm going to now copy and paste this and send it as a text message. So that would be an example of how I would send that. So I will cancel for the moment, and that's allowing me to look at, but we will save this, and I would then go into this button and send it as a message. Okay, cancel. Okay, so that's looking at one example of this, and I will save this for the moment and I'll come back to it later on. So that's me looking at a blood result, and once I've done that, I'm now going to change the color coding to green, and that shows me that that job is complete. So I will go through my list of all my bloods and x-rays and check everything there. Say if I come to correspondence, so this is saying there's a surgical report from the 8th of August 25 for me to review. Again, I'll open up the patient, and in this case the report is the last one that's there. So I will read through the letter, and I will decide that I've decided that I have nothing there for me to act on. No new diagnoses that I need to change, no medication that I need to change, nothing that needs to be done. Fine, I have now viewed that. And I will now say .jg, which means read by me on that given date and time. And that will also now be viewed, John Garvey. It's viewed there, and at the very bottom it says when it was viewed, etc. And so we would expect that you don't have to send a message, put down something as detailed as that, but there should be something to notify everybody in the practice who's seen it and possibly when. Because we're a big practice. There's 10 partners, a lot of trainees, doctors, nurses, etc. And it's to just, when you have a bigger practice, you have to think in terms of the mindset of making things as clear as possible for your colleagues. So that is how to look at those. There was another functionality I wanted to show you, and that would be back actually in blood results. So we'll come out of here, and I'm going to come back into this file, and I'm going to have a look once more at the lipids. So say, for example, I wanted to look at the LDL cholesterol, and I wanted to know, has that changed? To do this, I highlight on the result, and I come to this green button, active item analysis, and I click on this, and it will show me all the pre-existing values for the LDL cholesterol with a graph. If I want to see the graph in more detail, I can double click on this. It will show me the graph in more detail, and if I even want to print this out or add it to a referral, I can do that, print. So that's everything. The most important thing is that we're seen to check results, and we're seen to notify the patient of the result. We will generally tell patients, if they have not heard from us a week after the result was taken, or the scan, the x-ray, or the blood was taken, then they need to contact us, because they must assume that the result has been missed and no doctor has seen it. Okay, thank you for watching.